Welcome everyone to today's webinar, Reinvigorating Infection Prevention, Key Strategies for Healthcare Professionals. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. First, if you would like to submit any questions throughout today's session, please type them into the Q&A box you see on your screen. Second, today's session is being recorded and will be made available after the event. You can use that same link used to log into today's webinar to access that recording. Third, our webinar console also includes a webinar survey. We kindly ask that you take a moment and complete that survey before we wrap up our session today. And then finally, if at any time you don't see your screen moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into that Q&A box. We are here to help. With that, I am pleased to introduce our wonderful panelists joining us today. We have Frank Wilson, nurse manager with Norton Hospital, Shahalari Colbert, nurse manager with Adventist Healthcare, Fort Washington Medical Center, Hannah Schufelt, cardiovascular operating room nurse manager with Springfield Memorial Hospital, and Tammy Straps, clinical nurse manager with Harris Health System. Frank, Shahalari, Hannah, Tammy, thank you so much for being here today. Let's get started with our first question, which is about you. Can you each share a bit more about your professional backgrounds and your current organization? Frank, I'll turn to you first.
Thank you very much. My name is Frank Wilson, and I have been a nurse for over 30 years. I started with my associate degree and worked in a cardiothoracic ICU, and way back then when we had true CCUs. And I've recently completed, back in 2019, my Doctor of Nursing Practice in Executive Nurse Leadership. And my little shout out is for the University of Kentucky. They are celebrating their 20th year of being the first program to start the DNP program in the United States. But my background has predominantly been, for the first half, ICU, open heart recovery, and for the last 15 years, I've been a manager for cardiovascular thoracic step-down units here at Norton Healthcare. Thank you.
Thank you, Frank. Tammy, can I turn to you next?
Sure. Hi, I'm Tammy. I've got 30 years of nursing experience. I started off as an OBN, and I went back and got my associates and then my bachelor's and my master's. Majority of my clinical experience has been here with Harris Health System, specifically LBJ Hospital here in Houston, Texas. And I've spent the last 7 years in a clinical nurse manager role for an IMU MedSurg tele unit. I'm also an active member of our differentiated practice committee to professionally develop nurses, and our champion of our fall task force. Also serve on ANCC for mentorship, and active with ANA TNA. Harris Health System is integrated. We're a safety net hospital and system here in Harris County. And we also have same-day clinics, specialty clinics, dialysis centers. And at LBJ, we are level 3 trauma. We see more than 80,000 visits in our emergency room yearly. And thank you.
Thank you, Tammy. Harris Health System playing such an important role in the community. And you mentioned 30 years experience as a nurse?
Yes, ma'am.
Okay, so far we're at 60 combined between you and Frank. So Shahalari, let's turn to you next. Let's hear from you and learn more about you.
All righty. Good afternoon, everyone. I am Shahalari Colbert. I have been in the nursing field for 25 years now. I, like Francis and Tammy, started my nursing career as an associate degree nurse, then went to my bachelor's degree, master's in business administration, and also a master's in healthcare administration. My experience is very much in perioperative setting, but I've also had some cardiac ICU experience as well. Have very familiar with starting up cardiac programs. I've taught at university facilities, small community, nonprofit, and also surgery centers. Fort Washington Adventist Hospital is a community hospital, and we serve a wide variety of patients in the metropolitan area here. My scope of practice now, I oversee the OR, the pre-op and post-op area, endoscopy, and sterile processing, as well as our PAT department. So I'm excited to be here this afternoon and to start a discussion with you guys. Thank you.
Thank you for being here, Shahalari. And Hannah, let's turn to you and hear from you next.
Hi, everybody. I'm Hannah. So I've been a nurse for about 5 years, so I can't compare to all of you with the years of experience. my background's been in the cardiovascular operating room. I did do 1 year of floor nursing. I've been in my management role for about 1.5 years now, and my experience has all been at academic medical centers, most of it being here at Springfield Memorial Hospital, and we're about a 500-bed hospital here. So I oversee specifically our cardiovascular ORs here. And then I also sit on the board of directors for ANA Illinois.
Terrific. Well, 90 years experience shared between the 4 panelists. So I think that, Hannah, the 5 years, every single year is valuable. So don't discount yourself. But what a great group. We're so excited to feature your expertise today. Let's start by talking about your infection control priorities today and for the remainder of 2023. What are they? This topic was never not important in healthcare and hospitals, but it seems to have been the subject of renewed attention and value after the COVID-19 pandemic. Wanted to start by simply checking in about what you hope to accomplish and what work you're doing to achieve those goals. Hannah, you finished the introductions last. I'm going to turn to you first with this question.
Absolutely. So our infection prevention is more so limited to the OR side of things. A big focus for us over the last few months has been limiting foot traffic inside the ORs. We are seeing a lot of people going in and out who weren't really adding value to those patients in the room, didn't have a need to be in there. Sometimes we're just going in and chit-chatting. And I myself was guilty of it. I try to round on my teams in the morning. And a lot of times that just means walking in the rooms and checking on them. Do you need anything? And then just kind of making small talk. So I kind of started staying back afar and peeking in the windows, giving me a thumbs up if they know to kind of motion me into the room or call me if they need me. And then another thing we're working really closely with our infection prevention team is eliminating shaving in the OR. We're seeing with a lot of our open heart patients, we're consistently shaving their chest, shaving their legs inside the operating room, and that hair can kind of float around, settle on the back tables, contaminate the setup, contaminate instruments, all leading to increased risk of infection. So we've worked with our infection prevention team, our pre-op area, and then the nursing floors as well for patients that come from the floor areas before surgery to make sure that's getting done before we ever enter the OR suites.
Thank you so much, Hannah. So rounding a bit more strategically to avoid any unnecessary exposure to the space, also, eliminating shaving in the OR to avoid hair contaminating surfaces and instruments, really important work. Tammy, can I turn to you next and hear about your goals and the work that you're doing to align and support them?
Sure. 2 of the top priorities that we have, and I have for the unit 2 is we're working towards a high reliability organization. And so that means zero harm. And so regarding zero harm with our patients, we do daily Foley line reviews on a daily basis to make sure of necessity of those items. For infection prevention measures, we are doing some just-in-time coaching for hand washing. We have our quality team integrated with us for donning and doffing of our PPE, and they'll do those in real time with our staff. Also looking at bundle compliance for our CLABSIs, our CODI prevention. Really the focus is zero harm. And so with that, we also do unit recognition awards for zero harm if your unit has been CDIV free or CLABSI free, to bring awareness that these initiatives are meaningful and that staff get recognition for it. Another part of that is incident reporting. We have a great catch section in our incident reporting so that staff can feel that they can report things that could potentially be a harm incident, and that way we can mitigate those. The second initiative we really have is focusing on a healthy work environment for nursing staff. And so not just the self-care promotion activities, but also infection prevention activities, such as we've added in our skills fairs, hands-on training, simulation lab training is new this year, which we're super excited about for our new graduate nurses coming in that haven't been as hands-on, plus our nurses that are already been there for a while. They can go in and do simulation for infection prevention or any other type of skills that they need. We are also promoting the self-care at the unit in the pavilion base and increased our hand sanitizers, cavi wipe holders, portable hand sanitizers, just really focusing in on our staff and our zero harm for our patients.
I mean, just one quick follow-up question for me there. What's the difference between the lab and the simulations with hand washing and sanitizing versus the just-in-time piece you mentioned earlier, the
Um,
coaching?
Sure, sure. When we do our just in time, it's really on the unit when you're in the middle of things, and so those are in real time. When we do our simulations, you're kind of in a controlled environment, and so you get to learn all the mechanisms of it. When you get out on the unit and the floors, things start running and getting really busy. So we do have people that come in and do like a secret shopper, and just to kind of help our staff to realize the importance of it. And if you've got a whole bunch of things in your hands and you're trying to go into a room, what steps do you need to take to protect yourself and to protect your patients? So that's where that just-in-time coaching comes in.
Okay, got it. Thanks for the distinction.
Sure.
Frank, I'm going to turn to you next. Some really important work occurring at Harris Health System, at Springfield Memorial. What's happening at Norton Hospital in terms of infection prevention goals and work aligning with them?
So at Norton Healthcare, we've really been focusing on that reaching for zero, trying to push that out from that thought process. And we've been looking at our CAUTIs, our CLAPSIs, our C. diffs. What we found really is the basis of using interdisciplinary rounds or multidisciplinary rounds, however your terminology that you use at your organization, really makes a big impact in looking at line necessity. Is the central line needed? What are the options? Is the Foley catheter needed? What are the options for that? Then ensuring bundle compliance. So every day we're addressing with the staff and then addressing with physicians the need for lines and the bundle compliance with things. The other aspect we're looking at is for C. diff. It's really, we have a great antimicrobial usage stewardship that our pharmacy leads with us, and really trying to make sure that we're using the proper antibiotics at times if we don't need them, not to use them. And we try to make it fun. And you have to make things fun and engaging. And I will share in just a moment before, because it'll steal my thunder. But so it's really important looking at those on a daily thing. And then as an organization, we as managers talk about that every day with the directors, where are we at with our lines, and addressing that with our staff, and we follow up with that. The fun part, in a sense, is we recognize, just like everyone else may do, I've got two different things to show that may or may not come across, but this was created by our infection preventionists, and it's a team effort, but this really talks about the slam dunk for no C. diffs in 2021. And this was presented in our healthcare leadership program to our department, and then posted. It's in my office. The staff get to come in, they look at it, they have fun about it. And then another one about no CAUTIs in 2021. So you look at those things, but you have to engage the staff, because you tell staff what to do and you follow through with it, but they need to understand the why and see what that importance. And the other thing is, just like I'm sure everybody else, one of the things we found was rounding. When you're doing your leader rounding and rounding on staff, is talking about where we are. We're a very transparent organization at Norton Healthcare. We have 5 adult hospitals, 1 pediatric hospital, and the only way we've ever gotten better is sharing this information out with people. So every month when I'm rounding, I talk to people and I say, here's how many CAUTIs we've had this month, this year, how many had year before, how many CAUTIs, CLAPSIs, C. diffs, falls, any kind of healthcare acquired condition we talk about. And so that's one of the other driving forces, I think, more so than what's happened in the past, how we go through the future, is being open with our staff.
Thank you, Frank. I really appreciate the visuals too, that you were able to show us how you can work in some humor, some levity and fun to make the staff really lean in and more engaged versus just instructing them. I think that's really important. You know what, Shahali, before I check in with you, Tammy, you had mentioned something that I was remiss in not looping back on and double clicking on, and that was the concept of zero harm. And that's something that we hear a lot about in this space, but I thought for our listeners, it might be beneficial if you could just share a bit more on that concept and give us a bit deeper of an overview of it.
Sure. For zero harm for us, that means really just having that mindset that, a patient comes in with a lot of, comorbidities and things, and we don't want them to leave with anything that they didn't come with. We don't want to add that extra thing to their life there. So it's taking a look, like Frank mentioned, and doing those line necessities, asking those questions of why. We do that twice a day with our nurses and on up to our quality team, and taking a look at, is this the best intervention for our patient? Are we putting them in the best position to heal? And creating a culture that doesn't want to cause harm. And so we do this by really doing these audits, making it interactive for our nurses, because of course as frontline leadership, they have all the information that we need for us to be successful. So just really getting them involved and saying, hey, do we really need this? Is this necessary? What else can we think of? We've implemented, a lot of external catheters and different types of things like that to prevent Foley usage, and things. So it's really just taking a look and creating a culture around you that is very proactive.
Thank you so much, Tammy. Shallery, let's hear from you. A lot of important work occurring with your colleagues, some ambitious goals, and the daily work and lining up to support them and achieve them. Can you share an overview of what you're working on for the remainder of 2023?
Absolutely. So some of our initiatives that we're looking at are surgical site infections, of course, reducing our cardianclapsy and our C. diff as most other organizations. And really our primary goal is to help accomplish this by doing zero harm and eliminating hospital-acquired infections. As we all know that these have a tremendous financial penalties on organizations. So some of our measures that we're doing are implementing standard work processes, clinical pathways, and operating more as a system to reduce variations in practices. And so we have a saying here, it's called Our Main Thing. And our main thing is departmentalized. So each department has measures that they're working on. And so for my department, it's SSI is our focus. So we report out every month and we show the staff where we are with our infections. And so the three main infections for surgical services are hysterectomies, total joints, and colon infections. So we report out, we educate the staff, we have pathways put in place to reduce those numbers of infections. And ultimately, our goal is to provide world-class service to our patients and communities. There are a lot of measures that are put into place to prevent this. We do education with our patients preoperatively, intraoperatively, and also, intraoperatively, postoperatively, and then also education to our physicians, to make sure that we get buy-in from our physicians, our pharmacy, as well as the staff. And as was said earlier, we really need the buy-in from the staff to really carry out the mission of the organization. So our communication boards have been very instrumental in helping to drive that message. So it has worked thus far, and that is truly what our focus is here at Adventist Fort Washington.
Thank each of you for sharing those overviews. It sounds like a lot of different work occurring in the day-to-day, but all toward this very, very important goal of safer care and zero harm for patients. Shallery, I'm going to stay with you for my next question, and that is in regards to PPE. So COVID-19, one of the big things that happened there was that PPE went from a relatively, unless you worked in healthcare, you might not be familiar with that acronym or what it is. And then it became such a publicized concept where even people who had no healthcare experience were well aware of PPE and the shortages providers faced in early 2020 and for months afterward. Obviously, the pandemic really called attention to the crucial and valuable role of personal protective equipment. Beyond masks, I'm curious, what crucial protective equipment should clinical leaders really not overlook or underestimate in terms of making sure their teams have access to it, making sure it's high quality? I'd be curious to get your thoughts here, Shallery, because this is something that in the work you all described, you need the tools to do it, right? And PPE is certainly one of them.
Sure. So for me, I think some of the crucial PPEs also that need to be looked into are eye protection and gloves. And as we know, during the pandemic, we did have issues with eye protection. We were purchasing eyewear at Home Depot and Lowe's because we couldn't get it from our primary suppliers. Gloves, we were looking at gloves to see if we had gloves that were a little bit thicker. So what we found was some of the floors would get surgical gloves because they were a little bit thicker than your regular exam gloves. When you think about protection, you think about what are the things that you really need in your day-to-day operations to protect your staff and as well as yourself from any microorganisms. And it's the hands, the gowns, your eyes. You could talk about shoe covers if you wanted to even say that. But for me, I think the focus should be on the eye protection and the gloves going forward. During the pandemic, it really opened up a lot of things that we typically don't think of day to day, that we kind of brush it to the side and not realize that it's really as important as it is, but eye protection. So during the pandemic, my PACU nurses, part of our policy was that you had to have eyewear if you were at the bedside. So we were able to purchase some eyewear, but I did find that eyewear was another area that was hard to really get your hands on during that time.
Thank you so much for that overview, Shallery. Tammy, I'm going to check in with you next. We're talking about the PPE, and I know Shallery just mentioned it. Eyewear was emphasized in her response, but also gowns. That's something that I remember seeing headlines about and news articles about. So I would love to also learn about the need and the distinction of gowns, because there's different types too. So if you can talk about what, beyond masks, the crucial PPE that you really feel clinical leaders should not overlook or underestimate.
Sure, absolutely. Prior to COVID, our Harris Health was using a linen washable infection prevention gown that at the time we thought was great. Now with COVID, we became quickly having issues with our supply and demand, and we moved to a disposable gown. And we had to go and look at the AAMI standards, and they chose level 3 and level 4 standard disposable gowns. But this really kind of opened us up to the world of disposable type gowns, and we've stuck with it since then because of the fact of permeability and durability and wearability. It's much easier. So I think it's really important when you're looking at things like that, particularly gowns, masks, gloves, anything, that you have a system in place. We have a value analysis system that is an interdisciplinary team that meets and looks at products, makes sure that their ratings are suitable for what the nurses staff need, and then also have a system in place that if there is products that come along, that you have a product complaint process. We have a form process that our bud clinicians can utilize. So if there are products that come through and they're not meeting a standard, they can quickly fill out product complaint forms and get this somewhere. So it's really just having those processes for nursing, and for anyone that's using these products, to be able to voice their opinions on what they're using, because as during COVID, we were constantly, and we still have these problems where we get substitutions products in all the time. And so having a good process for that, for example, when we have an item that is on back order, emails will be sent out to ask nursing leaders, are these products going to be acceptable for your staff? And so we're allowed to be able to have the clinicians take a look at the product, and before we choose yes, and then having those substitutions in. Just really just having processes in place to be able to handle changes that are are beyond your control.
And if I can, just a follow-up question there about the processes. Can you talk a little bit about processes in terms of the assessment of the levels of gowns you had mentioned that are used when, and determining what is most appropriate in terms of protection for isolation gowns or gowns used outside of the OR? Can you describe the process at Harris and how those decisions are made?
Sure. I believe it's 2008, we developed this value analysis team. And so part of their role is to coordinate and to ensure quality and safety measures are met. So we do have infection prevention staff, nursing staff, supply chain staff on that committee. And so when they look at products, they look at the ratings of these particular products. And so we went with the thought process that, we need to have these higher standard of gowns for our nursing staff, because, during COVID times, we had huge numbers with Bean County facility of our COVID patients in there, and we needed to protect, our non-COVID patients and our staff as well. So we developed this value analysis program that takes a look at the ratings, make sure that we're in compliance with what we need, and then have the vendors come in and demonstrate products for the nurses to make sure that they are also into agreement. So it's kind of a collaborative.
Yeah, and I'm going to turn to you next. I think as your colleagues' remarks show, there was a lot of making do in a time of crisis. And now as we settle down, it's really important that healthcare leaders and you in your roles feel like you have the resources you need. Can you talk a bit about any of the PPE or personal protection equipment that you feel there could be still some inertia to overlook or underestimate its importance, but you feel is really critical to accomplishing the work that you highlighted for us in your opening remarks?
Yeah, I think like Dave said too, gloves and eyewear are very important, especially being in the perioperative side. Eyewear was kind of part of our standard practice before, but you still see a lot of people going without oftentimes. And I think the pandemic really raised the importance of wearing those on a regular basis, especially when you are going to be exposed to body fluids, maybe an isolation patient, whatever it may be, having that eyewear available. I know during COVID, we were allowed one set of eyewear and we had to keep it in a brown bag in our lockers because we just didn't have enough at the hospital to get a new pair every time. And that was the same with our N95 masks. We were reusing them. We got one new one a month, I think, for a while. And then I think gloves as well, they were on back order. We switched brands several times. And like Tammy said, we also have a value analysis team here that deals with those substitutions and loops in the clinical team. Are these going to work? And sometimes though, there was just no options. It's like, this is the only option left. So you get it in. We saw several pairs of thin gloves that were ripping easily and staff were getting frustrated with them. So then they'd end up not wearing the gloves maybe, or, well, this is my third glove I put on and there's a hole in it, but I'm done getting a new pair. And I think that really raises the risk of infection and puts our staff in harm's way potentially, and also gives them the opportunity to maybe transfer something to a patient that they're with right now from a previous patient earlier in the day. So I think making sure we have adequate supplies that are safe and then just having them available as well are so important right now.
A lot of organizations and teams, there were so many changes made to what was used, whether it was in terms of availability or quality decisions. But Tammy had mentioned her organization started off at the beginning of the pandemic or before using linen washable infection control gowns. Hannah, does your system or hospital use reusable or disposable? Can you expand more on the gown piece a little bit, if you don't mind?
Yeah, so we've always had disposable gowns here, and there was no change to that during COVID. One thing we did see was some of our normal gowns that we had been purchasing went on back order. For example, in the OR, we used to kind of carry those level 3 and level 4 gowns. And now we went to only carrying the level 4, dealing with the procedures we deal with. And then the hospital did make a change from some of the yellow isolation gowns that you see out on the floors and in clinic areas. They were having some level 1 and level 2s. They've moved those up to more level 2 and level 3s because they did have concerns from nurses out on the floor that maybe they were getting saturated, stuff was soaking through, and they just weren't as comfortable. So we did make that switch during COVID as a health system.
And then are any unrated gowns used?
Not to my knowledge, no.
Okay, great. Thank you, Hannah. Frank, let's check in with you. We're talking PPE. What is top of mind for you in terms of making sure you've got how much you need, and then 2, the quality is there? And I might ask you some follow-up questions based on what you share.
Well, I will just start with, as being a nurse for over 30 years, my family has been in the optical business. So eyewear has always been something important to me. We don't always think it as a nurse, but, ski goggles that have prescriptions in them And then everybody started seeing different kind of face shields for the people that already wore goggles. So I've had these for years. Who knew that I was going to need them for COVID and everything else? But our availability of equipment was very difficult. Like Tammy, like Hannah, like Shallery talking about it, Norton Healthcare has always looked at how to provide the best equipment for our staff, or what's the best item to have based on that whole value analysis team. And I think that whole integrated process, if facilities don't have it, I think it is a standard for a lot of places to have that kind of team that has the facilities, has nursing, has IP involvement with it to really direct things. Over the years, we have used both disposable and non-disposable gowns. We currently use level 2 reusable gowns. We were able to get a supply with those. During COVID, like everyone else, we did have to look at our different supply chain. Our supply chain management team, you used to meet once a month or once a quarter for a value analysis team, and then you look at substitutions and adding things. During COVID, it became the value analysis team had small people that represented the supply management team, and they were constantly looking for new resources, looking at the different items. We've tried to always stay with the level 2 gown for the non-sterile procedures, but even that has some differences. Permeability, some gowns did saturate a little bit more than others from different vendors. We would then X those vendors off and stay with other vendors specifically for our level 2 gowns. That's one of the big things we noticed. And then eyewear, just trying to come up with something, as Hannah said, issued one pair or put it in a bag, but we had enough, we were able to get some disposable ones in, those tiny shields or something like, I'm not sure what they're called, but the little face shield things that cover your glasses and or just your eyes. Those are the biggest challenges that we faced and looked through, but it was really having an IP team and a supply chain management and a nursing team that were constantly communicating to figure out what resources can we have, and listening to the staff, just as they mentioned, gloves that would tear easier or gowns that would leak, we would then quickly X those out of our supply and bring in new ones.
Thank you, Frank. I've heard a lot about the value analysis team through your remarks, and I'm curious, when it comes to the various levels of the gowns, specifically unrated, AMI 2, AMI 3, AMI 4, Frank, how do you ensure that your team is and your staff is selecting the appropriate level of protection? Is there anything else in addition to the value analysis team that should be in place or that you do to make sure those decisions are accurate?
Yes. So for things coming into our supply chain and being stocked on units in different departments, it goes through that supply chain management, works with the value analysis team, which is a subsection normally in most facilities of that grouping, and with IP, who's also in there, and look at items. So we'll bring in something and say, what does the vendor say? What is their recommendation? How do they classify it? They've gone through either OSHA, AMCs, or we look at NISHAs. And you take all those different things, and for our gowns, all our gowns are just a level 2 or AMC 2, and that's what it is. So there is no option for unrated or anything else. This is the choices that they have provided. And there are a couple different choices that are on that too, based on whether you're over at Children's or something else, but we pretty much try to standardize what was available on level 2s and then level 3s and 4s for the different procedures that are sterile and need that. So reducing the same journey for high reliability, the D&V ISO 9000, trying to get into that gear is, what is your process? So our process is only making available approved items that staff can use.
And then for the reusable gowns that have come up a couple times, I'm curious, who or how do you ensure the efficacy of those? Is there someone that monitors the quality, or some metrics or measurements that are taken on the reusable and rewashable ones?
There are. I couldn't tell you specifically, but I do know that we look at that to follow up on how those gowns are doing, and when do they get replaced and when do they come out of service.
Thanks, Frank. Tammy, Shahalari, Hannah, is there anything else about the distinction of the various levels of gowns, unrated, AMI 2, AMI 3, AMI 4, how those decisions are made in your organizations that perhaps may differ from what Frank shared that you would like to add?
So for me, our gowns are really determined by the type of procedure because we're in a perioperative setting. Our gowns are determined, the use of which gown we use is duplicative of the procedure that we're going to do. So if we have procedures that are trauma procedures, a lot of bodily fluid, we tend to go to a higher level gown, which would be the level 4s. And then, as you know, the level of gowns have the protection on the arms, on the chest part area. So that is also, we take that into consideration when we're looking at the procedures. And as we know, those gowns are hot as well. So some of the physicians prefer to do a lighter gown, but may still want a protection. So we may do a 3 or may not have the protection in the sleeves, but only in the chest area. So for us, it's really determined by the type of procedure we're going to do. And if the patient has any microbial organisms, we also take that in consideration. And then just, you know, the type of procedure that we're doing, truly the fluid levels plays a big role in the selection of the gown.
Thank you, Shahalari. Hannah, Tammy, I'll check in with you, and if nothing to add, we can move on.
I don't have anything too much to add. We are very similar to what Frank and his hospital do. We only offer level 4s in the operating room, so there's no confusion or selecting the inappropriate level of a gown.
Thanks, Hannah.
Yeah, that's the same process for us. Level 4s in the OR, level 3s on our inpatient units. Thank you.
Thanks, Tammy. Well, we talked about your goals with infection control. We talked about the resources and tools to achieve them. Let's talk about education, which has been such a key component to staff buy-in, staff compliance. Are there any educational resources, Tammy, I'll turn to you first here, that you don't currently have access to or receive from your supplier that you feel would really empower the staff to more critically think about these decisions and make more clinically informed decisions when it comes to choosing PPE?
Sure. We have technically started this. This was something we have not had until just recently, so it has not been standardized. So I'll kind of include this as a potential to, to empower. But it's having introduction of vendor days. With COVID, we had limited access in, and so post-COVID, there's a lot of different types of products, whether they're PPE or equipment and things like that, that really our nursing staff had a lot of interest in. And then also our vendors wanted to show us, different types of products or making sure we're using things properly. So we have one coming up, and this is what it's during our nursing skills. We're going to have vendor days. And so that allows our vendors to come in and really interact with nursing on the one-to-one or our, our IRs, radiologies, whoever it may be, to show the products that they have, even to show us some potential products that maybe we haven't even thought about. And I believe that we had a trial with our clinical research nurses and some selected clinicians, and the response was really positive because it gave them that one-to-one time with our vendors to be able to really talk about their products and what they have and how we're using them, and to see if there were potentials of improvement.
Love that, Tammy. So these vendor days that you've already trialed and did a pilot with, got some great feedback. Are they a bit more collaborative? Is it less of just a tutorial for your staff and your team as it is you being able to also give some feedback to the vendors in real time?
Yeah, it's very collaborative. So what we've done is we've sectioned off a section, and what we did is have a nursing skills section in part of our hospital, and then we have an open area where we have various vendors being able to come in. So you're able to go from from pod to pod, from vendor to vendor, and get the information you need, and to be able to, sit with them one-to-one to have conversations, to trial out. For example, we have a new new product called AirTap. It helps move our patients more safely, on the bed and things like that. So you're able to get in and take a look at those items and really have an interactive conversation instead of just watching a video or having somebody do a quick in service on the unit for 2 minutes and then be gone. So you can do those follow-up questions, or even be able to see new potential items that you haven't seen for skincare or for pressure injury prevention, or or PPE.
Thanks, Tammy. Frank, let's hear from you next. Any educational resources? I think Tammy's idea of vendor days, it sounds like, Tammy, although it might not be in play and routine just yet, it's on its way to becoming just that. Frank, what would you mention in terms of things that you would find really helpful from the supplier to make more clinically informed decisions about PPE?
So from suppliers, from that perspective, everyone has taken time to look at what they have and offer. I think our biggest thing is providing the right information in doing it in a fun way. That's the hardest thing. Most everything that we get from educational part is very structured, and they have to be, and I understand that. So what we've tried to do is collaborate and take information from vendors, and then we've had quarterly education for our staff on use of beds, use of the different PPE equipment, practicing donning and doffing equipment. We actually had to do that, and we actually did that prior to COVID coming in, as we started to look at things. So those are the kind of things, is making it a realistic aspect for the staff person to use without being so heavy on the hard material.
Sure. I think that's in line with everything you've shared thus far, Frank, with the ways you've recognized various achievements on your team. So I think that makes a lot of sense. Hannah, let's check in with you next. We're talking about educational resources or opportunities, engagement from vendors that can help inform PPE decisions. What are you missing? What do you wish you had?
I think, like Tammy mentioned, I think the vendor days would be something great. That's not something our team gets too much of right now. And I've hired a lot of new grad nurses who probably aren't familiar with, like, what does level 2 versus 3 versus 4 mean when we've only offered 4 the whole time, because we definitely have the opportunity to use level 3 gowns in some of our procedures. I think the thought has always just kind of been the fear of somebody using a level 3 when they should be using a level 4, because majority of our cases are going to be those level 4s. But you do hear a lot of staff and physicians complain sometimes, especially during COVID when we were getting different suppliers because of gowns being on back order. They didn't like the texture of the gowns. Some were hotter than others, some were thicker. I think letting staff kind of get their hands on some different ones and figuring out which ones they like best. And I think that would help with a little bit of their staff satisfaction, especially when they're scrubbed in for an 8 or 10 hour case and they're sweating up there and they can't do anything about it right now.
I can imagine, Hannah. You mentioned the level 4 gowns. Are there any non-sterile procedures in which those gowns are used, the level 4s?
We don't do any non-sterile procedures up here, so I can't speak for the rest of our hospital on that, though.
Okay. All right. Thanks for taking my follow-up question. Hallery, excuse me, you get to round out our wish list of what educational opportunities and tools you wish you had in your back pocket. Can you share?
Sure. Well, one of the things that I wish we had was more visual information on packaging. So if you think about some of the staff's day-to-day functions, when they go to grab items, they look at it really quick. It's like a quick glance. If there was probably more information on the packaging to say, like it could have like a picture of fluid on the gown, on the packaging, to show that this gown is more for heavier procedures versus the smaller procedures. I think that would be helpful. In addition to vendors coming out to educate the staff, that's always a good method of trying to get the message across to staff as to the appropriate use of gowns or any other supply for that matter. Hands-on demonstration is always wonderful as well. And the other thing that I really like too is pamphlets, videos, webinars, those things that kind of gives it a different spin, because when vendors come to a facility and do an in-service, sometimes if the time is unprotected, you're competing with other priorities. So you're trying to focus on getting your patient into the room, you're trying to focus on what somebody may be saying coming, that may be walking past you. But I think if we had more resources in video or pamphlets or handouts, then that way people could do it at their leisure and it wouldn't feel as rushed, really trying to understand what the purpose of the gowns or gloves or eyewear really would serve its purpose for. I think that would truly be helpful. But again, it's demonstration, it's more visibility on packaging that is friendly, usable, as well as videos and pamphlets would be ideal, I think, for staff.
I think some real common sense ideas there, Hallery. And I'm going to go back to something you had shared before, which was that the decisions about which level of gown is used at your hospital with Adventist is largely informed by the procedure at hand. Would it be helpful to have more explicit guidance from vendors on which procedures certain AMI levels should be used for? Should that be a bit more teased out, more available, more accessible, more explicit, like I said?
Absolutely. That truly would give staff the quick and dirty, as I would call it, as to which one I need to grab first. And when I'm trying to do a case and I want to go, okay, I remember them saying that this gown could be for a hysterectomy case. I'll grab this gown. Absolutely. Any information that vendors can provide to staff is absolutely welcome.
I imagine that might even decrease the cognitive burden of having to make those choices yourself if you have at least a bit more of a framework to reference.
Yep, absolutely. And packaging also serves as a tool, because if you think about it, when you go to the grocery store, most of the time you may not remember a product, but if you remember the packaging or the commercials on it, you say, oh yeah, I remember that is used for such and such. So the packaging would make a difference too. So maybe they could do a red packaging for level 4, or they do yellow for 3. And so the visual cues are really what help drive the staff towards their decision making and selecting a gown.
Mm-hmm. Love that. Great idea. Well, panelists, I want to thank you, each of you, for your time, your insights, your expertise today. Are there any closing thoughts that we'd be remiss to not include in our conversation? Well, we hit it all then, didn't we, in the past 50-something minutes? So I want to thank each of you. That is all the time we have for today. Thank you, Frank, Hallery, Hannah, Tammy, for just this excellent discussion. My thanks too to Cardinal Health on behalf of Becker's for sponsoring today's webinar. To learn more about the content that was presented today, please check out that resources section on your webinar console and fill out that post-webinar survey. Thank you so much for joining us today. We hope you have a wonderful afternoon.